On this episode of Smart Medicine, Memphis, Tennessee, a city known worldwide for blues and barbecue, is fast becoming known for something else.
Our children are dying at third world rates.
A crisis in our country, and Memphis is at ground zero.
In the year 2008, we buried, I think, it was close to about 313 infants at least there.
Why are babies in Memphis and Shelby County dying at rates more than twice those across the nation?
To me, there's just no reason for that to happen.
Find out what's being done to protect those too weak to protect themselves.
Seeing those precious children, they're so small, struggling for life. It's heartbreaking.
These children are the future of our society.
And meet those who are taking the lead in turning the tide.
We're not going to let a solution to this escape us.
It's all just ahead on Smart Medicine. Hello everyone, I'm Joe Birch. Welcome to Smart Medicine, the Mid-South's first look every month at health news that matters to you. Thanks for joining us for this very special episode devoted entirely to a problem plaguing our nation and the Mid-South in particular, infant mortality. A baby's cry, the first sign a parent gets of a healthy newborn. But in hospitals across the country, more and more parents are becoming familiar with this sound. Row after row of ventilators, all sending out tiny puffs of life-sustaining oxygen to frail lungs, struggling to take it in. This is the Newborn Center at the Regional Medical Center. The facility, commonly known as the Med, is an acute care teaching hospital that serves a 6-state region within 150 miles of Memphis, the hardest hit city in one of the hardest hit states for infant mortality.
Med, as you know, is the safety net hospital. One of the things that Memphians are fully aware is the Regional Medical Center is a resource not just for Memphis, not just for Tennessee, but also for Arkansas, for Mississippi, and we even get babies from parts of Missouri, Kentucky. What I see here is predominantly indigent patients with poor prenatal care. Some of them are teenage moms, and quite often I see repeat customers.
The whole problem of infant mortality, particularly in Shelby County, is one that, quite frankly, has escaped resolution in terms of defining why. I would dare say that if we knew why, we'd be well on our way to making significant cuts in those numbers.
Those numbers are staggering. In the U.S., nearly 7 out of 1,000 babies born will not see their first birthday. That puts us all the way down to 29th on the list worldwide, near the bottom of developed nations. But when you focus on the Mid-South, the numbers take an even more disturbing turn. Statewide, Tennessee ranks third worst in the nation, with nearly 9 deaths out of every 1,000 born. In Memphis and Shelby County, the number of deaths jumps to nearly 13. Among African Americans, nearly 19. And in one of the city's poorest zip codes, 38108, more than 30 deaths per 1,000, putting that neighborhood on par with Vietnam and Iran.
There's a crisis going on out here in this country where our children are dying at third world rates.
Author and producer Tanya Lewis Lee is the spokesperson for the Healthy Baby Begins With You campaign, a program initiated by the U.S. Department of Health and Human Services. Lee, wife of filmmaker Spike Lee, is here in Memphis with her team of documentary filmmakers and a team of student volunteers to raise awareness, particularly in the African American community, about the growing problem of infant mortality.
As I understood Memphis having the highest infant mortality rate in the country, I was trying to figure out what happened here. And I think that stress plays a big part in it. There's been economic downturn here. As someone said to me the other day, it's a perfect storm of race and poverty that's happened here, which will absolutely affect the infant mortality rates.
As Lee and her team spent the day getting the word out on the streets and in businesses, one question helped put a face on the grim statistics.
Does anyone in here have a friend or know someone who lost a child?
Rosalind Hardy did.
And it was stillborn.
Mm-hmm.
And how far along in your pregnancy?
21 weeks.
21 weeks.
Mm-hmm.
Rosalind is a mother of 6. 2 of her children were born prematurely. A 7th did not survive.
After the baby came out and he was dead, and it was like they got quiet in the room, and it's like I was just laying there on the bed, and I was saying in my head, I was like, I bet the baby dead, because didn't nobody say nothing after I had the baby.
Corey Pruitt Jr. died just 21 weeks into Rosalind's pregnancy. This box, with a few keepsakes,
It's the gown that he had on.
and a tiny silver marker numbered 8555, are all she has left to remember him by.
Because I thought I was past this, but I guess I'm not. Because I thought I wasn't going to cry, because it's been so long. But when I see the little spot that they put him in.
Corey was laid to rest here at the Shelby County Public Cemetery, known to many as Babyland. Some of the infants here are remembered with flowers and toys, most by just a number on a small marker, lost to time, and some fear, lost from the public eye.
It may help some if they came out and looked at all the grave sites out here and everything for the numbers, and I'm quite sure a lot of them are not aware of the number of infant burials that we do out here each year. From 1965 to 2008, we buried roughly around about 12,000 babies at this particular location. In the year 2008, we buried, I think, it was pretty close to about 313 infants at least then.
That tells you how large the issue is, that we really got a problem, and I think we need to get to the root cause of it. Before we come out here, which is the end of the cycle, we need to do something at the beginning of the cycle to prevent it.
The numbers does seem to increase each year. There are more and more, that are being buried out here.
Enough is enough. Yes.
Joining us here on Smart Medicine, a distinguished panel of authoritative experts on infant mortality. We're delighted tonight to welcome Antoinette Holman, the Infant Mortality Reduction Coordinator for Shelby County here in Tennessee. And joining me right next to me here is Dr. Giancarlo Mahri, who is a professor of obstetrics and gynecology and the chief of maternal and fetal medicine at the University of Tennessee Health Science Center. And he came here, he tells me, 20 years ago from Salerno, Italy. He intended to stay 6 months, and Doctor, you're still here. Yes. 20 years later. Well, we're glad you're here. Thank you very much for being here.
Thank you.
Joining us as well here on Smart Medicine, Dr. Sheldon Coronis, founder and retired director of the Newborn Center at the Med, and a man many consider the father of neonatology. Dr. Coronis, a great pleasure to have you here. And of course, also with us, the Reverend Dr. Kenneth Robinson, the Shelby County Health Officer, former Tennessee Commissioner of Health under Governor Phil Bredesen, also the senior pastor of St. Andrew AME Church on South Parkway. A delight to have you here, Dr. Kenneth Robinson.
Thank you.
Well, it's a pleasure to have all of you here. Let's begin with Antoinette Holman, who has devoted her career to this very important infant mortality reduction effort and this initiative that's happening in the Shelby County, Tennessee. And tell us exactly what you're doing to try to reduce infant mortality in Memphis and Shelby County.
Okay. I'd like to start out by telling you the definition of infant mortality. It's the death of an infant before his or her first birthday. And with our initiative, our goal is to increase positive birth outcomes here in Shelby County. And I do that through education and collaboration. I provide awareness about the causes and effects of infant mortality in our community, and I collaborate with existing organizations